9 supplements to avoid while taking prednisone. Hi, I'm Dr. Megan, the Prednisone Pharmacist. I'm here to share with you 9 supplements that you're going to want to avoid while taking prednisone because they can either cause a drug interaction or make it so the prednisone doesn't work very well. So, without further ado, here are the 9 supplements to avoid while taking prednisone. First, we want to avoid aluminum hydroxide containing things. This can include Tums and other Mylanta, things to help with upset stomach, Malox, things like that. Not all Tums and not all Malox and not all Mylanta things include aluminum hydroxide, but you do want to avoid aluminum hydroxide because it does block the absorption of prednisone. Up to 40% of the prednisone is basically bound up into this aluminum hydroxide complex, and it's not going to be absorbed. So if you were normally taking 10 milligrams, if you take aluminum hydroxide with it, it's as if you're only taking 6 milligrams. And so you don't want that. You want to get exactly the amount of prednisone you're actually taking. The second one is St. John's wort. Now, St. John's wort would make perfect sense to me for someone to take because it's often used to help with depression. However, it is broken down by a cytochrome P450 enzyme in your liver that will block the breakdown of prednisone. And so we do not want to take St. John's wort as a supplement while taking prednisone. It's a really bad combination. Next is licorice. Now, licorice makes a lot of sense to me because this is an adrenal support ingredient, often used in supplements that help people build back up their adrenals if they have perceived a loss of adrenal function. However, the licorice will directly counteract the prednisone. We do not want to take licorice or other adaptogens while taking prednisone. It's just not the right time to be worrying about your adrenal system. The fact is, while you take prednisone, you have effectively turned off your ability to use your adrenals to make cortisol and other steroids. And so just don't worry about it until you're way below 2.5 milligrams prednisone equivalent or lower before you even consider thinking of taking a licorice. And it's like the licorice root and not like the candy. Want to make sure you know there's a difference. We want to avoid those because it can really mess with your ability to use the prednisone properly and eventually recover your adrenal system. Number 4 is alfalfa. Now, people might use this because prednisone is causing high cholesterol or other issues with the metabolism. But again, this is causing a drug interaction. We want to avoid that. Number 5 is activated charcoal. Now, I can totally see somebody gaining weight from prednisone and thinking, oh, I need to go on a charcoal cleanse. Now is not the time. While you're taking prednisone is not the time to go on an activated charcoal cleanse because the charcoal is like a sponge and it will just suck up the prednisone, and then that's going to cause adrenal insufficiency. You don't want that. Just avoid activated charcoal while you're taking prednisone. Number 6 includes lily of the valley, and this is a common weed that can be poisonous, and the combination with prednisone is not good. Number 7 is buckthorn or alder buckthorn. Again, just don't do it while on prednisone. It can, people might use it to help with as a laxative, but it's going to cause low potassium, and prednisone itself is causing low potassium. So you might get extremely low electrolytes like potassium, and that would really not be good for your body. You never want to mess with your electrolytes in that way. Number 8 is grapefruit. Now, technically, this is a fruit and not necessarily a supplement, but you could supplement with it. And it is because grapefruit has in it the ability to block the enzyme that breaks down prednisone. So you'll have extra grapefruit in your body. Number 9 is a common one. This is ashwagandha. It's become really popular in recent years. And ashwagandha, people might think, oh, I'm feeling really stressed and I need this stress relief supplement and I need help supporting my immune system. However, ashwagandha might stimulate the immune system too much. And if your doctor is prescribing the prednisone for an autoimmune condition, ashwagandha might stimulate the immune system too much and be fighting against the way prednisone is trying to help you. Again, people might think, oh, I'm having joint pain and that's why I'm taking prednisone, so I should take turmeric because it can help with joint and other inflammation. However, turmeric can cause a drug interaction with prednisone because it's broken down by the cytochrome P450 3A4 enzyme, and it's blocking that. So the prednisone won't break down properly. So again, avoid turmeric while on prednisone. And finally, I have a few bonus questions you might have of other supplements that you might think, is this safe? Can I use it? What do you think, Dr. Megan? So some questions people have asked me in the past include, can I take melatonin with prednisone? And yes, I definitely recommend taking melatonin with prednisone because prednisone and other steroids have been shown to diminish our ability to make melatonin while taking it. And we don't want to avoid melatonin. You can take melatonin while on prednisone. What about nature's Ozempic, the weight loss supplement Berberine? Generally, berberine is okay to take while on prednisone, and it can help with 3 of the most complained about side effects: weight gain, high blood pressure, and high cholesterol. So it's a great choice. What about cannabis or CBD and prednisone? Now, this one's pretty nuanced because CBD can cause a drug interaction with prednisone, but it depends on the other drugs that you're taking, whether or not this actually matters. I have a whole interview I did with a CBD expert where you can learn all the nuances of what you need to know about CBD and prednisone. Check that out. Finally, what is one that a bonus of what you should avoid on its own? And this is calcium. You want to avoid calcium all by itself because calcium, if you are not adding on the other nutrients that it needs alongside it, like vitamin D, magnesium, to get the calcium into the bone, then it might deposit in your arteries and cause artery hardening or calcification. We don't want that. Prednisone's already causing heart disease. So let's not have hardening of our arteries, and make sure if you take calcium, you take it along with other bone support ingredients. So if you're thinking, oh my goodness, that was a long list of things to avoid, Dr. Megan, is there an easy way to remember this? And yes, I created a downloadable PDF of not just the supplements you need to avoid, but also the vaccines, the vitamins, the drugs, and even the foods you need to avoid while taking prednisone. So just click the link below to download the 25 things you need to avoid while taking prednisone. Signing off is Dr. Megan, your prednisone pharmacist.